So pathogenesis, why there is febrile seizure? Definitely parents will ask you. The etiology is not yet clear, or the etiopathogenesis is still not clear. That is what we are trying to tell here. Of course, we cannot tell this directly to the parents, but in children who have febrile seizures, you can tell them that the neurotransmitters, the heart disturbances and the ion channels firing and all can be a little different from the normal children. So we will talk about this here. So the thermoregulatory response, where a child gets a fever, the response to the fever is disturbed. The inflammatory response is also disturbed. Interleukin 1 beta is the one inflammatory mediator that you have to remember when you are talking about febrile seizure. IL-1 beta is a pyrogen. It will cause fever. It is elevated in fever. And it is a seizure provocator. Very, very important. It is a seizure provocator. It is also an NMDA agonist. So, the neuronal firing is activated in such children because of the altered thermoregulatory response. Look at the picture here. We are not entirely sure that to pinpoint at one particular pathogenesis, but there is a child who is genetically susceptible, who has this abnormal gene loci, and in such children, whenever the child gets a fever, there can be sodium channel gene expression different. So the sodium ion channels opening can be a little altered. The thermo dysregulation can happen. There is an altered blood-brain barrier to the neurotransmitters. The hippocampal can be hyperexcitable. So all this can coexist in a child, and when in a genetically susceptible child, when there are environmental triggers, be it an infection or be it a vaccine, this can happen. So this is what is the etiopathogenesis behind febrile seizure, one of the very common events, but we still not able to identify what exactly is the event or what exactly is etiopathogenesis behind it. So we have talked about febrile seizures, incidence, prevalence, whatever, and why it happens. But now I will tell you the definition, very, very important. In the age group 6 to 60 months, if the child gets a seizure accompanied by fever, the fever has to be more than 38 degrees Celsius or more than 100.4 degree Fahrenheit documented, very, very important. And this seizure and fever should not be accompanied with a CNS infection. There should not be a metabolic disturbance. There should not be a previous afebrile seizure. Very important. Okay. And an acute insult like a trauma should not be present. Only then you can call it as a febrile seizure. Further, we will talk about classification and all. For now, a seizure with fever which is occurring in the absence of a CNS infection, in the absence of a metabolic disturbance, in the absence of a previous afebrile seizure, and any acute neurological insult like a trauma in the child for 6 to 60 months. So these 4 points you have to remember. Now coming to the classification. So febrile seizure can be further classified as, you all know, simple and complex febrile seizures. Simple febrile seizure, again the classification is going to be quite difficult because most of the times the parents are not able to describe how was the event, because looking at their own child seizing in front of them can be very traumatic, that they are often they find it very difficult to recall how did the event start, or how long did the event actually took place, and what was the aftermath of that. So all the events they might fail to recall, but because of your probing questions, they could tell some of them. And if at all they have a video of the child seizing, it is very good, very, very well appreciated. It is very easy for us to tell, or if it was it a GTCS, was it a focal event, it is very easy for us to tell. Okay, so coming to the simple febrile seizure. Simple febrile seizure means all these 4 criteria has to be classified. Only then you will label as simple febrile seizure. So what are these 4 criteria? Number 1, it should be a generalized one, right? Generalized tonic-clonic seizure. Second point is, it should last less than 15 minutes. So look at here, spontaneous cessation has to happen within 15 minutes. 3 will be in the 24-hour period, there has to be have only one convulsion, not more than that. Okay, only one episode in the 24-hour period. And number 4 is no pre-existing neurological abnormality. Okay, so simple febrile seizure means only one seizure episode in one day, and that event was generalized, and that event lasted only less than 15 minutes in a child with no pre-existing neurological abnormality. Right? So all these 4 criteria, if it is classified, then you will write the diagnosis as simple febrile seizure. Whereas coming to the complex febrile seizure, if even any of this one was classified, if any of these one of the 4 criteria was present, then it is safe to classify as complex febrile seizure. That is what many of our teachers have taught us, and many of the even the definitions have come up in that way. So like complex febrile seizures, whenever you get a focal event, right? focal event or a generalized event which was very, very prolonged, that is more than 15 minutes, or if it had a record within the 24 hours, or if the child had a prolonged postictal phase or a postictal deficit, any of these four safe to classify as complex febrile seizure, right? So, very importantly, you should know what is a febrile seizure, how do you classify a febrile seizure, and now how are you going to approach. Now that you are sure it is a febrile seizure, now comes the real challenge. Should I do a blood test? Should I do a CT imaging? Should I do MRI? Should I do EEG? Should I do lumbar puncture? All these comes to our mind.